And good evening, everyone. Good evening, good evening. Hope you're all well. Hi, Crystal. Thanks for joining. Hi, everyone. Thanks for joining. Hey, everyone. So it's been a while, and it's good to be back. I haven't done this in about 4 or 5 weeks, so I'm so glad to see you guys all joining. Thanks for joining, everyone. Liesel, Lady. Good evening, Lady. Hope you're well. Thank you for joining us. So tonight we're talking to Dr. Tebogo Deo, and she's a director at Genesis Reproductive Clinic. They are out in Pretoria, and we're going to give a minute or two before we invite her. We are very excited this week because on Sunday we're having our first VIP luncheon. It's happening at the Million Boutique Hotel. So for those of you who've got tickets for it, can't wait to meet you all. I know it's going to be a great success. You guys are going to enjoy the day, enjoy the talks, and I hope it brings you some hope. So yeah, I'm just going to invite Dr. So I know she's got just going to invite on her other page at the moment, other name. Let me see, there's a request. Doctor, if you can just maybe send me a request. I need to find a new one. Otherwise, we'll just wait for her to come online. There you go. Okay. Okay, so like I said, Doctor's actually going to go live on a new account tonight. So I'm just trying to find that account. Deo. And there we go. It's the right account that I've got tonight. If not, Doctor, you can just let me know. I think she's coming online now. So here we go. Okay, Dr. Tebogo joined. Let me just inbox that one. Here we go. Okay, Doctor, I've just invited you. There we go.
Very
Hi, Dr.
good.
Deo.
Hi.
How are you?
I'm good, thanks, and you?
Good, thank you. I'm sorry, I was trying to make sure I've got the right one account because there's a few different accounts.
Correct.
So I just wanted to make sure I got the right one. So Genesis is actually one of our top sponsors for this event that's happening on the weekend. We are super excited for this event.
Correct.
I think I've been ready for a few weeks already, so I can't wait to see everybody again. It's been very stressful, but I'm so glad it's happening and everyone's excited about it. And things are just nicely falling into place the way it's supposed to be.
Yes.
So we thought we'd just kick it off before the weekend. So Doctor's going to be doing one of our top talks the weekend. She's going to be talking about whose fault is it. Can't wait to hear that.
Yeah.
It's going to be quite interesting. For those of you who unfortunately won't be able to make it, we will have snippets on the day, so keep on our socials. On Sunday, it starts at 10 o'clock, and then you'll be able to see some snippets and photos, and we'll try and keep you guys updated as much as we possibly can. So today we're talking about trying to conceive after sterilization. For those of you, it's your first time that's been here and so forth. This is Dr. Tebogo Deo. She's from Genesis Reproductive Centre, and they're out in Pretoria. So, Doctor, if you don't mind just giving them introduction of yourself, please.
Good evening, ladies, and hopefully some gentlemen there. I'm Dr. Tebogo Deo. I'm a fertility specialist and a director at Genesis Fertility Clinic, which is based in Kloof Clinic in Pretoria, Eastern in Erasmus, Kloof. Yeah.
Okay. Thank you very much. So we're talking about sterilization and the types of sterilization, and also trying to conceive after sterilization, which is most important, which most of our ladies are here for, I think. And you know, things happen in life where you know, you've had kids and then you decide afterward you think you're done with it, but unfortunately life happens and they meet someone new, and you know, then you decide you want another child afterwards, after you've already been sterilized. So what types of sterilization is there, first of all, to start off with?
Okay, so first, let's start by saying what is sterilization? It's tying of the tubes for a person that has decided that their family is complete, and this is a method of family planning contraception that they want to use. It is a method that can be done both for male and female. And hopefully we'll have a little bit of time to touch on both, where you can sterilize women and you can sterilize men. In women, you can do tying of the fallopian tubes, and there's several methods that are there. You can do it immediately postpartum. That means immediately after you deliver, you can do it at cesarean section, where usually with that one, a lot of tube is tied and possibly even cut. You can do it after delivery within the first up to a week or so after delivery. You can still sterilize because the womb is still high up. You make a small hole in the belly button, you pull out the tube and you can close it. And then you have, and this method you can still do even later on, not immediately after you are pregnant. And then you can do outside of pregnancy, you know, just gynecological. You walk in and you want to have a sterilization done. And what we routinely do now these days is do a laparoscopic, which is a keyhole operation. We put a camera through the belly button and we can put either rings or clips. I must say most of us are putting clips now because it's the most reliable and the safest one, where you put clips in the tubes as a form of closing the tubes. And then you have the one for the men, where they tie the tube that sends the sperm from the testicles to the penis. We call it the vas deferens. You make a little hole in the balls and then you tie both the tubes. Men also have two tubes on both sides. You pull a loop and then you tie those tubes as well.
Okay. And so what are the options when so after you've been sterilized, and you decide a couple of years later that you actually want another baby, you want to extend your family, what are the options when trying to conceive after sterilization?
Okay, actually, we must first start by saying that no method of family planning is 100% safe. So there is still a risk of falling pregnant spontaneously after you have had a sterilization, you know, which is not necessarily a good thing when you are not intending to have a child as a couple. And that is why usually we would recommend that a person sterilize after the age of 30, 35, because the risk of this happening is 1%. But when you are younger, less than 30 is up to 5%. And then what can you do when something, life happens, either you lose the baby, you change your mind, though actually sterilization is supposed to be a permanent method of contraception. It's not supposed to be something that you do as temporary. It's not something that you do with the aim of changing your mind. So we actually are supposed to do it such that it should be really as foolproof as possible. But should something happen and you change your mind, the first option is reversal, where we have to go in and check whether it is possible to put the tubes back, and then you can fall pregnant spontaneously. Okay, the best one that you can reverse usually is the filthy clips ones, where you put the clips in, and that one, your chance of reversal is very good. And this depends mainly when was it done, which the one that is the worst likely to be successful is the one that's done immediately after delivery, because a whole length of tube is taken. And then the best one being this one, where you just put clips because it's a small segment. The next thing is, where exactly was this clip done? So the closer is done. So if you imagine my arm is the length of the tube, the closer you put it to the womb, the better the chance of it being reversible. So we would first do a laparoscope to go and check. So you first do a diagnostic laparoscopy. There you are checking how much of length of a tube is left, and you check what are the two ends that you are putting, do they meet, or is one broader than the other? Because if it's broader than the other, where they meet, there's at least 50% risk of ectopic pregnancy. So how much length do you have? Is the length, the diameter equal? And how far from the womb was the sterilization done? And then based on that, then we will tell you, is it possible to reverse or not? And then if it is not possible to reverse, then we are looking at in vitro fertilization, because now the tubes are not available anymore for you to fall pregnant spontaneously or to do insemination. But we also look at the age of the person. We look at what is your ovarian reserve, because if you are much older, you are 40 years or so, then it's not worth it to actually first start, do laparoscopy, then reverse, and then you try by yourself, because anyway your ovarian reserve is less. So then it is, you might as well go straight forward and do in vitro fertilization.
Yes.
And then the one that is the worst to be reversed is actually the male sterilization. It is the one that which is the least risk of failure, but it's also the worst to reverse.
Okay, so I actually, when I set up these questions, I actually had not thought of on the male side. I'm always thinking, I think I was always thinking on the woman's side with sterilization. And I'm glad you actually brought that up, doctor. So what are the chances with men and sterilization? Is it, so you're saying it's worse when it comes to men?
Yes.
And what procedure then happens with men if when the male is actually being sterilized? Yeah.
So first, after the man is sterilized, you must wait for 3 months where you are using protection, because there's still sperm that is in the tube. So you can still fall pregnant after 3 months. Then we do a spermiogram after 3 months to confirm that there's no sperm piercing. So that's where we know that your chance of actually falling pregnant is almost next to nothing, because if the sperm test comes back saying 0, then we know that the sterilization has been successful. And then later on, if they want to reverse it, it's more or less the same thing as with the men, with the women, that the urologist usually will try and put the two tubes together. But because the tubes are so small, you know, it's a microscopic surgery. We have to do it under the microscope. There are not that many people with that skill. And even after they've done it, the chances of now the sperm being able to pass through is very, very slim. So usually then we just go and do either testicular aspiration, some form of collecting the sperm directly from the scrotum. And that kind of sperm, you can only use it to do ICSI. You can't use it for insemination. You can't use it for natural conception.
Okay. So does my age matter with tubal reversal surgery, or is IVF a better option?
Okay. So age does matter, but let's not say age, let's say ovarian reserve, because we've seen people who are young, but they still have a reduced ovarian reserve. You've had multiple surgeries, you've had endometriosis, or you just have a propensity that your reserve will drop very quickly. So age matters. So we know that after the age of 35, the pregnancy or the fertility rate drops remarkably, and we know that at the age of 40, really the fertility rate really also drops by 50%. So we would check first your AMH, look at your follicle count, and based on that we will tell you whether it is worth it to go that route or to go straight away in vitro. But sometimes you get people who cannot afford to do IVF, in which case then that reversal, but unfortunately in South Africa, reversal, you have to actually pay from your pocket. Most medical aids don't pay for it. I'm not aware of a medical aid that pays at this stage. So you would still have to raise a lot of money to actually do that. So if you say, okay, this is all I have and I'd prefer to do that, maybe it can be considered, but the best option is to actually go for IVF straight away if you are older.
Yeah. So also, are you saying when it comes to if you're having to pay for it, your best option financial wise is actually to go straight IVF?
Correct, because you are going to pay the doctor, the anesthetist, and you still have to pay the hospital, you know, and it's a major surgery, anesthetist.
Also don't know if it's going to work.
And then you're still sitting with a 50% risk of ectopic pregnancy. So, I mean, whereas you know that with IVF, even though we cannot guarantee you 100%, but at least we take away all those other risks of anesthesia, surgery, as well as ectopic pregnancy. At least we're just looking at the risk of in vitro fertilization only.
Okay, thank you. What other factors need to be considered before deciding on tubal reversal? You kind of
We would
answer that, but it's the recap maybe.
There's other factors like the BMI of the patient. We look at your health status, Also, we look at the skill of the surgeon, because not everybody is able to do reversal. And it is better if it is done as a minimal invasive surgery. So laparoscopically, we were trained those many years ago to do it open, but we also used microscopy. So it is important that it is done by a skilled surgeon, somebody who has been trained to do it, and your BMI must also be low, and because the surgery is quite tricky, and all other medical conditions that we have to look at for a person to conceive. So just like any other person that is looking to conceive, we would check those status as well.
Okay. Thank you so very much. We've got a question. It's safe to do IVF at age 39 as a woman and my partner at 43. If you don't mind answering that question.
No problem at all. It is safe to do in vitro fertilization, but having said that, the person must remember that after the age of 37, the risk of aneuploidy, which is Down syndrome and all that, is quite high. And a person at 39 has got the risk of preeclampsia, diabetes. But having said that, the regulations of SASREC are saying that in South Africa, you can fall pregnant up to the age of 50. Whether it be your own eggs or it is donor eggs. So 39 is fairly okay. So it is something that we can be able to do, yes.
Okay, great. We've got another question. If you don't mind, we just answer one or two questions. I have an irregular period. What should I do?
I would say you have to consult, because we need to, irregular period can be so many reasons, Is it the contraception? Is it your weight that is maybe need to be regulated? Are you having hormonal problems? We need to do a pap smear to check if it is normal. We need to do a sauna to check if there is no pathology within the womb. Do endometrial sampling, do hysteroscopy to check if the cavity is okay. So if you have irregular bleeding, go and see a gynecologist.
Okay. Thank you very much, Dr. Deo. So, guys, Dr. Deo is doing our talk this weekend on the 3rd at our fertility luncheon. And we're so excited to have everyone and to just have a great day. So, for those that you're going to be here, that has just joined us recently now, can't wait to see you guys all and have a great day together. Thank you, Dr. Deo, and can't wait to see you on Sunday. Have a great evening.
See you on Sunday, and I'm sure we're going to have a great day together. And for those ladies who will be able to come in, those who can't come in, indeed, we will try and put snippets on socials out there so that you can be able to see. If you have any more questions, you can send us at reception@drdeo, DRDEO.co.za, and hopefully we can be able to fit you in. And yes, there is hope if life throws you a curveball after sterilization.
It's absolutely amazing. Thank you very much, Doctor. Thanks for that. And have a great evening. See you soon.
Thank you, Leanne. See you on Sunday.
See you. Bye. Thanks, guys.